Today we're going to talk about customer service and the process improvement. When we think of customer service, we think of satisfaction guaranteed. They call this the 3 to 11 rule. For every good thing that happens to us, we tell 3 people. So if you go to a restaurant and you're enjoying the food, the atmosphere, you go and tell 3 other friends how much you enjoy the atmosphere. If you have a bad experience at a restaurant, the food is cold, the servers are slow, you're not only going to tell 3 friends, but you're probably going to tell a handful of strangers. This is where the 3 to 11 rule comes in. That is why when patients come to the hospital, each patient receives a patient satisfaction survey. They also receive a phone survey. The hospitals continue to thrive and grow because of listening to the patients and understanding their needs when they're in the hospital and also post-care. Let's think of some factors that influence satisfaction. If you were a patient going in for a procedure, create a list of issues you think would influence you as the patient to a good experience or a bad experience in the hospital. Having nurses introduce themselves, letting the healthcare providers know exactly what your medications are that you're taking, your fears are, getting your questions answered, or being ignored because they're too busy to answer your questions. I thoroughly enjoy this slide. AIDET, communicating with your patients. This is a great acronym to follow when you're taking care of your patients. A, acknowledge. Greet your patient warmly. I, introduce. Always introduce yourself to the patient, including your name, title, and what you're doing for them. D, duration. Always let the patient know what to expect and how long they will be there. Let the patients know if the doctor is running behind. E, explanation. Explain the steps and what the patient should expect to happen. First we will, next we will. I like this from an article, Talk, Listen, Learn. Finally, T, for thank you. Be sure to always thank the patient. You should be thankful that you are a healthcare provider and that you were able to help them today. It is important when working in the healthcare field to remember the 4 Ps. Check on your patients every hour. Check their pain tolerance, if they have to use the restroom, aka potty, the position that they're sitting in the bed if they need to be moved, and their periphery. Do their lines look okay? Do their IVs need to be flushed, or has their IV been infiltrated? Top 5 issues patients state are most influential in their customer service experience. Let's take a look at these because us as healthcare providers want to know what is concerning to the patients and how can we improve it so that the patients choose to come back to our facility to be treated. First is accessible. Limited access may result in delayed treatment. If patients are coming to the hospital and they're unaware of where the parking is at, or they do not have elevators, patients with breathing issues may take longer to get there, delaying their treatment. It is very important to have accessibility for the patients. The cost. Out-of-pocket expenses. Inflation, right? Everything is expensive these days. Patients may not seek care if the cost may result in delayed treatment or if they are not taking prescription medication. If the patient has to pay an astronomical amount out of pocket for a new medication, they may be on a fixed income and may not be able to take that medication, causing them to not come back to the healthcare facility. Compassion and kindness. Lack of kindness may result in lack of attention to critical instructions or avoidance of a follow-up care appointment. If patients are treated unkind or feel that they are just another number, they may be reluctant to come back and have a follow-up appointment with the same provider. Giving excellent service should be your number one priority, and patient satisfaction is always key. Current, updated, thorough, and thoughtful information. So what does this mean? Lack of information may result in non-compliance with essential follow-up treatment or medication. If a patient does not understand or they do not have the proper information explaining when they have to take their medications, how to take their medications, they may not follow up with the healthcare provider because they feel overwhelmed, dumb, or simply confused. It is always important to make sure that your patient understands and has all the information they need to have customer service satisfaction. And then lastly, waiting time. Delays may result in adverse outcomes. If the patient comes in and they have to wait an astronomical amount of time to see a provider, they're probably not going to schedule with that provider in the future. Quality of care. Quality patient care versus cost of patient care. Let's read that again. The quality or the cost of patient care. Patient satisfaction surveys versus actual quality, discussed basically and then reviewed in articles. Many patients do not mind paying for good quality care. Patients become very dissatisfied and disgruntled when they have to pay for unprofessional treatment and unprofessional behaviors. Always treat your patients with dignity and respect. The next slide is customer service and quality improvements. Patient initiatives. Sending out patient reminders. If you look at the patient's date of birth and you notice today's their birthday, sending out a happy birthday to let them know that they're not just a number. Many patients will tell their friends if they enjoyed the facility that they came to, and if they feel comfortable there, they're definitely going to give a recommendation. Comes back to the best and worst, the 3 to 11 rule. If it's your best experience, you're going to let 3 of your friends know. If it's the worst experience, you're going to let 3 plus 8 more people know just how bad it was. Loyalty. How loyal are you to your family provider? Do you enjoy going there, interacting? You become familiar with the staff there and you trust them. Efficiency. And also, lastly but not least, the discharge summary. Again, making sure that the patient understands their discharge instructions and answering all of their questions before they leave the building. This is a little bit of a scary slide for people that work in healthcare. The Joint Commission. Anytime that you're working the Joint Commission, the TJC, they accredit healthcare organizations. They have standards which are evaluated. They come into the healthcare facility and they document and make sure that you're following their rules. They're looking, 1, evaluate the standards and work with families and staff to decrease harm to the patients and to the staff. 2, advancing knowledge, skills, and competence of staff and patients by recommending methods that will improve quality and safety. And 3rd, encouraging and recommending proactive quality and patient safety methods that increase knowledge and trust but decreases blame and retribution. The quality improvement slide continues. Patient safety, as defined by the World Health Organization, is the prevention of errors and adverse effects to patients that are associated with healthcare. Some initiatives for quality improvement are listed below. We see listed here is site-side requirements, timeout, medication errors, decrease or eliminate unintended retaining of foreign objects. What does all this mean? you're going to begin to hear terms such as timeouts and brief intermittent timeouts, which means that all of the staff working with the patient will stand still. The staff nurse or staff instructor will then go through a timeout, introducing the patient's date of birth, the patient's allergies, any kind of medication that they're allergic to, and so on, to make sure that they're identifying who the patient is, that they have the correct patient, and that no errors are made. Later in the semester, we will discuss sentinel events that have led to medical errors. Here's a great acronym to describe quality improvement. PDCA, Plan, Do, Check, Act. Let's break this down a little further. Plan. An issue, problem, or suggestion needs to be analyzed in an effort to establish expectations and creates a plan of action. By starting from the end result and working backwards, each step of the process can be included in the analysis and in the solution. So what does that mean? This means that the hospital received a patient complaint on whatever the issue problem was. And now what they have to do is they have to create a plan of action. So they have to begin to go back to the beginning of the procedure and work their way through what exactly happened in the process so that they can analyze it and come up with a solution so that they don't receive a negative patient satisfaction survey next time. Do. Implementation of the plan. Now we're going to put the plan into the process, and we're going to begin to figure out what we're going to do. Check. Measurement the objectives to see how they meet expectation. This step allows for the adjustment of the plan where necessary. It also allows for small changes instead of a one-shot approach to attaining perfection and analysis paralysis that can ensue with that approach. Make sure that the measurements that you have come up with are meeting the expectations that the patient is complaining about. And then finally, act. Implementation of changes identified in the check phase. Make sure that everything that you have done up to this point will be implemented so that there is no negative patient satisfaction survey for next time. Almost finished, guys. The HCAHPS. HCAHPS are very important for consumers and hospitals. Hospital Consumer Assessment of Healthcare Providers and Systems. Standard survey dispersed nationally by mail or phone. 27 questions concerning communication, pain management, cleanliness of the hospital. I have posted a link that you can click on to find out more information in your area. And finally, the last slide, customer service and improvement. Survey your internal and external customers. Make sure that you guys know the difference between an internal customer, which is those professionals and departments you work with within the healthcare environment, versus external customers, your patients and people who come to your family for service. Dealing with constructive criticism can be very difficult, and we will discuss later in the semester. Just make sure that you know the difference between internal, inside the job, and external, the people that you're taking care of outside of the job. This concludes the PowerPoint for today.